the 2017 SA Drug Policy Week. TB HIV Care Association is an NGO that's been around since 1929. We've always been really committed to providing services to marginalized people. And our next challenge is to ensure that people who use drugs are able to access health services and that the policy framework doesn't impact negatively on their constitutional rights.
Why is it that some drugs are legal and others criminalized? Why is that? Is it because of the relative dangers of drugs? That alcohol and tobacco or some pharmaceutical drugs are less dangerous?
From my perspective, the most important message I have for the conference is that we can apply a rational, evidence-based approach to comparing the harms of different drugs and therefore develop more appropriate and rational policy outcomes. A conference like this is so important because for the first time it brings together people, practitioners, patients, but also policymakers and government officials into the same room to try to address the same problem and hopefully come up with answers which they can all support.
That I'm stressed today and I go home and I want to have a glass of wine or whiskey every day. It's okay. But if it is somebody else who is assumed not to be at whatever level of life and cannot afford whiskey, cigar, or something else, and potentially use marijuana to relax, which is cheaper, we stigmatize. All of those are drugs. What is the difference? Why does it get dispersed based on the social status of who the person or the user or the person who is seen to be different is?
I want you to gauge your first personal reaction to this t-shirt, okay? How do you feel when you see this t-shirt for the first time? Nice people take drugs. Okay? Think about it. How do you feel about it? And then imagine I was wearing a t-shirt which says, nice people drink Carling. How would you feel about that? What is the difference? Okay? And what I'm saying is that we all carry some kind of inherent stigma, and we need to be aware of it.
And suddenly the war on drugs was ramped up, the government instructed police, do something about it. But with drugs, police were completely clueless. So in asking the question, who is this evil drug dealer that I'm so told about, then that's where absolutely endemic, inherent almost prejudice comes to the fore. And that's where the drug laws accelerated racism. Really the only way to start eroding that endemic racism is to actually get rid of our drug laws.
But the point is that I met religious leaders. And the first question I asked them is this: do you want to stop STDs among young girls? Why don't you ask government to ban sex for all girls under 20? How can that be? I said, well, criminalizing drug use in order to prevent drug abuse is like banning sex for children under 20 because you want to prevent STDs.
Because only the person who's actually been affected by the laws because of his or her or the transgender person's use of drugs, will the government really know what's happening to the individual because of criminalization is arrested. So you are actually perpetuating criminality. You actually make a class of persons who just have recreational use of drugs, like alcohol and tobacco, into criminals.
In Africa, we still find things like this. In other words, drug users are treated a lot worse than criminals will be treated because they are chained to the ground. They are chained, that they are locked up, that they have no rights whatsoever, and so on and so forth. And that's the kind of thing that we see with, in Africa, which is really terrible.
Listen, you're a mom, you're a physician, you're a doctor, and you also don't use cannabis. Why you want to legalize? Because I am a doctor, because I am a mom, and because I don't use. This is not a domestic policy. It's a public policy. It's not for my religion or my party or it's not for a community. It's for all the country, or I prefer all the work.
I think that the policies that we're looking to incorporate and that we're hoping to get out of this particular conference is the recognition of the need for a dramatic shift in policy based on the human rights elements of the people that we are concerned about, who are the users and the injectors, the impact that it can have on their ability to be able to be reintegrated back into society and become meaningful members of the society.
We talked about very high-level meeting that happened within the UN compound, and my point was really how to use this as civil society organization and take these recommendations, this document to which our governments take the responsibility of implementing, and just to stress on the fact that this is now the role of civil society to hold their government accountable, because very often our governments go to UN or other international meetings and sign a lot of conventions, but then we never get to hear anything about it. So now it's all about knowing what's being done there and playing our part as civil society to make sure that they are held accountable.
I think it's important that conferences and discussions like this should help people question what they view as a drug and what they don't view as a drug, because there is a lot of hypocrisy. And I think essentially people should be given the knowledge and the skills to make decisions around their substance use. And if they require services to help them reduce the harms related to that, it should be offered to them and there shouldn't be consequences. So essentially people should be supported and not punished.
Someone showed me love and acceptance, and someone gave me a gap, and someone stopped judging me for being a drug user, and something in my head started to shift. Most of my colleagues, including myself, were sleeping under bridges and on pavements. And all it took was a simple harm reduction program, delivering needles and syringes, and just starting to talk to people about their health and well-being and trying to remind people to eat once a day if you can. And here we are today. I think currently we're a team of 8. We have over 2,600 service beneficiaries. We deliver over 33,000 syringes a month. I confirmed the numbers this morning. So we have 20 virally suppressed street-dwelling injecting heroin users.
Even for people in the drug policy reform world, we all grew up in a society in which the prejudice and ignorance around drugs and drug users and everything was just pervasive. And I think understanding the need to educate ourselves, to read not just some of the science and not just the medical aspects of this, but to actually understand the history, to understand where all this came from, to understand the realities around it. I think that's the first thing. The second thing I think is really for people not in this field, it's just about opening your hearts. It's about asking the question, if God forbid it was your kid or your sibling or somebody you loved struggling with drug addiction, how would you want the state to be involved? If it was somebody in your family who was a recreational drug user and not hurting anybody else, how would you want the government to deal with this? It's that sense of empathy and compassion where sometimes people need to be prodded because the stigma and prejudice is so powerful in this area.
So I want to talk to you about the issue of hope, because as was said last night, we could think of ourselves, perhaps, if I can include myself with you, we could think of ourselves as the first generation of drug policy advocates here in South Africa. We are beginning a process of trying to move towards a wider drug policy that respects the human rights of every person in this country, and to change the way the policies are currently organized such that they harm individuals or they segregate individuals.
The point that I made today that I think is most central is the issue of love, that actually this work is about loving each other, it's about caring for each other, and it's about bringing people back who have been lost from the love of the community. And for me, harm reduction, and particularly community mobilisation by people who use drugs, is the strongest expression of that sense of love of the community and also self-love of ourselves as people who use drugs.
are fundamentally imperative in terms of how people should conceptualize and understand both drug policies and drug laws. Currently, legislation that relates to drugs, criminalizing legislation, policies that socially exclude and stigmatize communities of people who use drugs, these laws, these policies are not rights respecting. People who use drugs have the fundamental human right to the highest attainable standard of health. They have the right to live lives free from cruel, inhuman and degrading treatment and torture.
In closing, I'd just like to reiterate that this project of drug policy reform is ultimately about social justice. It is not only to do with protecting individual human rights, but about exposing gross injustices and intolerable inequality for which our policies are directly responsible for.
Look for the opportunity to lead. It's not as if that only Europe can lead with harm reduction, or only America or Uruguay with cannabis reform, or only Latin America with initiating a debate about prohibition at the highest levels. The question becomes, are there opportunities in this country and in this region and continent to do productive, science, health-based, human rights-driven interventions and policies with drugs that nobody else has done before? To come up with unique local solutions that make sense here, even though they're grounded in the same universal values. Because ultimately, I hope I'm back here in 10 years. And I hope I'm at a drug policy reform conference that has 1,500 people like we now have in my country and many thousands of others. I hope there's a movement of people from medicine and from science and from law enforcement and from across the political spectrum really building a movement to end the drug war in this country and not this country. I hope that the number of people locked up in your country on drugs is much lower instead of much higher 10 years from now. But it will only happen by understanding the potential to provide leadership, to challenge yourselves around your own prejudices, to understand the broader communities and values of which you are part, and to understand that we are about building a movement for science, compassion, health, and human rights. Thank you very much.